Welcome to State of the Heart, the monthly podcast from the Community Care Network of Kansas. I am Denise Sisman, CEO of Community Care. Each month, State of the Heart will explore how we, our partners, and state leaders achieve our mission to deliver equitable, whole-person care to all Kansans, especially those who are underserved. We will explore foundational beliefs, policies, and practices through the lenses of community, care, network, and Kansas. Today, we shall discuss the theme of Kansas. Joining me today is Kate Gramlich, a new member of the Community Care team. Kate is our Cover Kansas project specialist who oversees a statewide network of marketplace navigators. Kate excels at linking people with ideas, resources, and tools to help them succeed, which made her a natural fit for this position. She also worked closely with Navigators during the two past open enrollment periods while serving as a community resource specialist at the Lawrence Public Library. Kate is a grant writer, a community volunteer, event organizer, and a marketer with a passion for community health. Kate earned a master's degree in communication and a bachelor's in sociology, both from Southern Illinois University. Welcome, Kate. It is great to have you join us.
Thanks, Denise. It's really great to be here. It's a really exciting time to join the team. Been a very busy week, busy past month. Open enrollment for the marketplace just began on November 1st, so we're really excited to get going.
As are we. We've already used some terms that our viewers might not be familiar with. We've talked about marketplace. We've talked about navigators. We will be, if we haven't already, talked about federally facilitated exchange. So let's start by having you explain what the marketplace means, defining that term, letting people know about this resource.
Sure, yeah. So it can be confusing. It's a lot of jargon to learn. So we call it the marketplace, which would be short for the health insurance marketplace, also known as the federally facilitated exchange, which is a bit of a tongue twister. So we go with the shorter version. But this program in general is designed for people who don't have health insurance already through their job or through Medicare or Medicaid or CHIP, which is the Children's Health Insurance Program, or another source that provides qualifying health insurance. So the marketplace in general is operated by the U.S. Department of Health and Human Services, and it's in place for states just like Kansas who don't have their own marketplace. So it's kind of just a shorthand term so that we avoid all the other longer ones.
Great. And we often wonder, do we really need insurance through the marketplace? Is that important to people? And to answer that question, we go back to some of our experts who are collecting and analyzing data specific to Kansas. And one of the most credible sources is the Kansas Health Institute. And they have reported data that show that more than 262,000 Kansans do not have health insurance. And if you think about it, that is 1 in 10 people. So if you're in a room of 20 people, you know that 2 of those are likely not to have insurance, in general. That gives you an idea of what we're talking about. So tell us a little bit about, who are the people who are not being able to access health insurance, and how does the marketplace provide them with this resource?
Yeah, thank you for asking. I like this question because I get to kind of dispel some myths about the people who are in Kansas and who are uninsured. So first of all, there's a common misconception somehow that uninsured equates to being unemployed, and that is just not the case for so many of these people. They are typically hardworking people with one or multiple jobs between the ages of 19 and 64. They are, like you said, they could just be 2 people in a room with you. They're your friends or neighbors or people at the grocery store who may work multiple part-time jobs or are self-employed or are working in farming or all sorts of careers and vocations that don't provide insurance. So they're also trying to kind of figure out how to spend their scarce resources. So all 160,000 individuals or so that are qualified for the health insurance marketplace, they earn wages that are either at or up to 4 times above the federal poverty line.
Yeah. Still not a lot of money to spread around and a lot of daily living expenses. So what happens if somebody doesn't have enough money to even afford the insurance premiums through the marketplace? Tell us a little bit about what's available to them and how they would access that kind of assistance.
Yeah, sure. So the 160,000 I mentioned, they all will qualify for marketplace coverage. It's more of a matter of if they qualify for financial assistance or subsidies to help pay for it. That Kansas Health Institute report that you mentioned shows that the majority of them, just about 128,000 or so, already qualify for subsidies because their household income is that low. The problem is that even with the insurance, many can't afford the premiums. They're just struggling to make ends meet, struggling to feed their families and keep a roof over their heads, keep the lights on. So, but I will say that there have been, this year, there are more people qualified for subsidies and financial assistance than ever before. So the chances are greater that you'll be able to get the assistance that you need to pay for your coverage.
Yeah. So, as we're looking at helping Kansans get access to health insurance, the marketplace is one very important solution. And it does help if you qualify with your income level. Again, 160,000 plus would qualify. That you can also get financial assistance if you're having trouble with or would have trouble with paying for the premium. So that's a lot of people. But we also talked about 262,000 plus Kansans not having access to health insurance. And another important group that we cannot ignore is a group that what we term or call people in the coverage gap. And those are individuals who don't make quite enough to qualify for the marketplace, so they cannot access health insurance through the marketplace, and yet they make too much to qualify for Medicaid. So they're in limbo. They don't have access to a solution to help them get health insurance. Tell us a little bit about these folks, and I guess maybe even more importantly, one of the solutions that we know is available and has been used in almost every state in the nation has been expanding the Medicaid program. And in Kansas, Medicaid is CanCare, so we will talk about expanding CanCare. Let's talk a little bit about how that could be a solution for people who fall within the coverage gap.
Absolutely. So expanding CanCare would be an amazing step for all of Kansas. It would be a great step because health insurance is just so important both for individuals and then also systemically and across Kansas as a whole. So expanding CanCare, Medicaid, if we became an expansion state, it would cover so many more people who fall into that gap, who they earn a wage that is just higher than than the cutoff for Medicaid currently, but they're not able to make those payments like you'd said. And having this health insurance is just so important. Like I said, both individually and systemically. So from kind of a larger picture, insurance, as we know, it helps pay for healthcare by combining the risk of high costs across a large group of people. That's how premiums are devised. They're based on the average cost of care across whatever group the individual belongs to. And so for this project, that group is extremely large. That would be dividing the cost among them. And then on the individual level, expanding CanCare and expanding access to health insurance will help individuals from those high unexpected medical costs and going into large amounts of medical debt. So, for example, just breaking a leg, easy to do. You would be paying, if you're uninsured, $7,500 or so, as opposed to paying a small monthly bill. And more important than that, you can have access to preventative screenings, checkups, wellness visits, counseling, immunizations, that sort of thing. So the things that prevent the larger expenses and larger problems from happening. So that's why it'd be really wonderful to expand CanCare, and why I know Community Care Network has been really working hard for advocating for that.
Absolutely true. And so, just access to health insurance overall helps to keep people healthy. It helps to prevent chronic diseases and other conditions. And it helps to catch chronic diseases and other conditions in their early stages where it's easier to treat. People who do not have health insurance tend to delay getting care, and they then, when they do need to go, because most everybody will need to go if they're delaying care, when they do need to go, that they have more complex medical problems, and they're going to need complicated and expansive care. That ultimately is going to cost more, and it costs more for the individual, it costs more for the state, and it quite frankly, it costs more for you and I as citizens who help to offset the uncompensated care that's needed by providing care to individuals without insurance. And so, expanding CanCare is one solution, and is an important solution to the group of folks that we talked about being in the coverage gap. But I do want to go back to the Cover Kansas Navigator project and talk a little bit more about this important resource and how we can access it. We, as at Community Care, recently received a 3-year grant from the Center for Medicaid and Medicare Services. It is for this Navigator project. Now, it's a newer grant. It's a new grant for us, but we also were involved in the Cover Kansas Navigator project and the overall marketplace effort really since its beginning. We had a little bit of a short hiatus within the past 2 years, but we're back and we're excited to be back. So talk to us a little bit about more about the project and what we hope to accomplish.
Absolutely. So we have more than 30 trained and certified navigators that are already in place at member health centers across the state. These folks are unbiased professionals who have been certified and trained in becoming a navigator, and they can help Kansans compare various types of assistance and healthcare plans that are available on the marketplace. They can look at different rates, levels of care, coverage options. They can answer questions about different definitions like deductible or out-of-pocket costs, that sort of thing. And they can help with the application process and actually help them fill it out. And it's all for free. So we're here just to help Kansans who are uninsured or possibly re-enrolling in the marketplace go through that entire process so that they're not alone in it. And like I said, the open enrollment period started November 1st, and it goes now until January 15th, which is an extended date compared to previous years. Although they can enroll throughout the year if they have a qualifying life event, such as divorce or marriage or losing coverage through their job or losing a job. They can qualify for a special enrollment period. But this open enrollment period is kind of when most people will apply for coverage. That goes through January 15th. And if someone needs help with the process at all throughout the year, but especially during this open enrollment period, the navigators are here. We've got ones that are placed in person at different health centers. And then we've also got some that are available over the phone or virtually too. Like I said, they're not required. You can go on to healthcare.gov if you feel comfortable and just go through the enrollment process yourself. But it can get complicated, and like we had said, it's nice to have someone there to answer the questions and to define the terms and things like that, especially one who's not biased and not trying to sell you something. That's kind of rare to find someone who's willing to help you for free without trying to coax you one way or the other. And I would say even for kind of the tech savvy among us, it's nice to have that help. I was about 7 years ago. I was recently divorced, and was too old to be on my parents' insurance, and working 2 part-time jobs, and trying to make rent and deal with a lot of new situations. And so I qualified for a special enrollment period, and a navigator over the phone walked me through the entire thing, and he was super duper helpful and just made me feel kind of like I had assistance during a really difficult time. So even if you are able to do it on your own, it's really nice to kind of have that help and that free help. Every state that uses the marketplace relies on navigators to help people, and that's for that very reason, is to kind of guide people for free and without sort of pressure or anything like that through the difficult, kind of confusing process. The Cover Kansas Navigators, we provide help in both English and Spanish, and again, this is all free to the consumer.
Yeah, we're so happy that we could help you, Kate. And, I have a similar story in that both of my children, when they became too old to be on my health insurance, now needed to enroll in the marketplace, and they were able to access Navigators in Kansas. Again, just to help them through that process and make sure that they were doing everything that they needed to do and providing the correct information. So even if you feel pretty comfortable about enrolling in the marketplace, or you've done so before, if you want to just have somebody there to double check and answer any questions that might arise, the Navigators are here for you. We do have Navigators that can provide assistance in person. They're located in many of our federally qualified health centers and other community-based clinics around the state. And also they're able to provide assistance over the phone. And we now, for the first time, have statewide virtual navigators that can provide services through the computer technology. We have loved this program. We have supported this program for many years. We have seen that over 100,000 Kansans have enrolled or re-enrolled in the marketplace. So while we're still looking at, 262,000 plus who don't have insurance, we know that the marketplace has been a solution to accessing health insurance for many Kansans. So, Kate, I want to thank you for being part of this vodcast today, and I want to give you a special thanks for your leadership and your direction in helping to get the Cover Kansas Navigator project up and going, having the 30 plus navigators in place, and now being able to begin to offer navigator assistance.
Thank you so much for having me. And for you all listening and watching out there, if you know someone who needs assistance in obtaining health insurance coverage, whether it's during open enrollment through January 15th or beyond for special enrollment periods, now hopefully you know where to go. You can go to getcoveredkansas.org, or go ahead and call our toll-free number at 866-826-8375. Thanks so much.
Thank you, Kate, and thank you to the entire community care team, as well as all of the navigators across the state who are working so hard, especially now during open enrollment, to help Kansans access this important resource. Health is so much more than treating illness or disease. It is about being healthy and staying healthy. And to do so in a world where healthcare itself is complex and changing almost seemingly daily, and quite frankly needs to change because our needs as patients and individuals also change. It is through programs like the Cover Kansas Navigator Project and individuals like Kate and all of the navigators across the state that help us to help community care remain committed to achieving that kind of future where all Kansans can have access to high-quality health care and can be able to achieve their optimal health and well-being. A healthy Kansas means all of us together. It means individually and collectively, we are all worth it. I am Denise Sisman. Join me next time for another State of the Heart.